My name's Katie Zimny, and I am a specialty pharmacist. I've been working at Lumicera now for about 4 years, and right now my role, I wear a couple hats. I am a clinical pharmacist, so I talk to patients on the phone about their medications, their specialty pharmacy medications. I also manage a team of pharmacists as well. And uh, the the third hat that I wear is leading a um, Oncology Center of Excellence group for clinicians, where we talk about challenges for patients and for medications in general in the oncology space. I feel like specialty pharmacy kind of found me when I was picking kind of um, rotations in school. We during pharmacy school, you rotate through different areas, and it turned out that one of the places I chose wasn't going to work out, the the professor just essentially told me this is what I'm going to do because that was what was available. And I would have never thought to look into specialty pharmacy. I'd never heard of it before. Um, and then after school, I did a residency where I worked in inpatient and outpatient pharmacy. So I worked in like in critical care and to like the outpatient disease state management. Um, and I think what I like best is that direct patient interaction. And ultimately, it led me back to specialty pharmacy because that's really a big part of what I do day to day is that direct patient interaction and consulting with patients. I think in healthcare, it can be really challenging to have time to talk about issues with health. And in specialty pharmacy, there's a lot of disease states that are complex. And I think just in general across the country, because we work with patients across the country, a lot of patients don't necessarily have all the time that they would like to in to talk about their medication with the at the doctor's office. And I think what I really like to do is to help fill in those gaps. So whether that's introducing what to expect about the medication, talking about side effects, um, and or potential side effects, or if a patient is experiencing symptoms, talking about how they can help manage those side effects and be able to stay on their medication. I also like solving problems, and each individual patient is there's can be something complex and something a problem that I can help solve for a patient with my very specific set of skills. I think Lumicera is a really good balance of being a business that at its core, the backbone is still patient care, that even as we've gotten bigger or grown, uh, that that backbone of patients being important and high level of customer service has not gone away um, from each individual pharmacist to a leadership level as well. So really people that work here care about patients.